The final days before kids come back to Denver public schools.
Next week, so we're down to what? One day, Friday, and then the weekend.
And this week, the school nurses are doing a refresh training on their skills. Ellery Archer is the Director of Nursing and Student Health Services in DPS.
For this school year, where our concentration is really on the unvaccinated student population, where we feel like that is an area where we could really make the most gain.
Last school year, DPS had an 84.3 compliance rate for school-required vaccinations, below herd immunity goals of 95%, and dropping lower year by year.
The percentage decreases that we're seeing are small, but they represent real people.
Not a new problem in Colorado, says state epidemiologist Dr. Rachel Herlihy, but still frustrating.
If you look at the numbers 5 years ago compared to the numbers now, so that 91% versus 88%, that translates to 9,000 fewer kindergartners in Colorado that were vaccinated. And so that does translate to real risk of vaccine preventable disease infections.
And new CDC numbers show school vaccine rates are dropping nationally too, amid increasing vaccine skepticism, misinformation online, and changing federal policies around vaccine guidance.
It is challenging, but I think that there are some truths that hold here in that, especially for healthcare providers, we know that patients trust recommendations from their healthcare provider. So it really is important for those conversations to take place.
Access to health sometimes is a barrier. It's not that the families don't want to get the vaccines, right?
Whatever the reason, Ellery's team sees an opportunity.
It needs to be individualized. Like we do individualized care for our students. When we work in the hospital, we have individualized care plans for our patients. So vaccines shouldn't be any different.
So we just looked at DPS for this story. Some of the district rates are far lower, like the 50, 60 percentile. The state says it's not even the county by county story here. Vaccine rates change in small pockets of communities, churches, neighborhoods, child care centers. They can vary. A couple of really interesting points here. So we've had an ongoing measles outbreak in this country, right? I know a lot of people have been going and getting their updated MMR. That's not reflected in this data because that's all been happening since this spring. And so we'll see that in next year's data. But I asked, would this maybe boost our numbers for the first time in a long time because people are responding to those outbreaks? We don't know yet. But we might see like a boost next year in these numbers.
And now I'm just curious. Yeah, a boost is definitely good. I'm curious just personally from my experience, I've been asked my child's vaccine records in order for them to attend school. Is that not a situation
I think every district, every child care center, every church, every group is going to have a little bit of a different policy. I can't answer that question for you for a district by district basis, but exemptions are allowed. Students can go to school with a formal exemption. This is interesting where we have formal exemptions. People say for a religious reason, I'm not getting vaccinated versus it's just out of date. They're catching up. They just immigrated to this country and haven't translated their records over. There's a lot of different reasons somebody may not be up to date, which could be a different reason for like, are they going to school or not?
Herd immunity, people.
Yes.
Remember what we learned during the pandemic.
Right.
Herd immunity goes a long, long way.
So true. I know.
Jenny, thanks.